Hey, what is up, everybody? This is actually the first time I have ever went live on YouTube. I used to go live on Facebook all the time, but I did want to use this platform because obviously on our channel we talk a lot about TMJ and TMD, and I want to address a question that I get asked a ton, and make sure that everybody's clear on this. And then in the future, if this works well, then obviously I will post a lot more like live Q&As where we'll talk all things TMJ dentistry, all things wellness-based dentistry, what we do in our office. And so if you get value from this Q&A, I encourage you to like the video and also subscribe. And today we're going to talk about one of the most common topics I get in our office, which is what's the difference between a night guard and a occlusal orthotic. And so first thing I want to let you guys know is that I do dental night guards in our office as well, in addition to occlusal orthotics. And they're totally different in how I use them and what they're designed for and who benefits from which. Okay, so for example, if a patient is in our practice, general practice, and just wants something to protect their teeth a little bit at night, we still do occlusal night guards, right? That is kind of the traditional, typical thing you get when you go to the dentist when they say, hey, you need a night guard, you're clenching, grinding, wearing your teeth out. Those are adjusted one time for about 15 minutes. You put them in and you're done with it. Contrast that with the occlusal orthotic. Now, occlusal orthotics are designed to help balance your bite, your muscles, and your joints, and make a definitive diagnosis of your occlusal system, whether it's you have TMJ and you're trying to get relief, TMD, TMJ, TMD, I will use interchangeably. I'm not going to go into TMJ as a joint, and you have two of them. But the reality is when people say TMJ, I know what they mean. They mean they have temporomandibular joint disorders. They have pain in the joints, pain in the muscles, pain in the teeth. Okay. If a patient comes to me and they're looking for relief in their TMJD, those are the times that I'm going to recommend we use an occlusal orthotic. Now, an orthotic is a little bit different than a night guard in a few very big senses. First, you wear it full time while we're going through the diagnostic phase. This is not something you only put in at night. This is something you wear full time. A lot of our patients actually, they will chew with it. They will function with it. They'll talk with it. It may look like a night guard. It's traditionally thinner because we're actively adjusting it, and we custom fit it to the patient in a way that most night guards, you're just not going to get that level of adjustment. When you're wearing it full time, we actually make adjustments. So we have patients that come in from out of state. If they come in from out of state, we're compressing the time component. So they might be getting 2 and 3 adjustments a day. And all we're trying to do is basically balance your teeth, your muscles, and your joints. I'm going to have future videos on this channel on how we actually do that. But just know that what we're trying to do with the occlusal orthotic is you wear it full time. We make adjustments on a daily basis, on a weekly basis, depending on whether or not you're from out of state or in state. If you're from out of state, we make 2, 3, 4 adjustments, as many adjustments as we can possibly get while you're in the office to try to relax the joints and the muscles and get your teeth to figure out where they're supposed to be. Okay. I'll give you a traditional example. If a patient is local and comes in to me with TMJ pain, typically I'm not going to recommend a night guard. Because if they're looking specifically to try to eliminate tooth wear, teeth breaking, difficulty sleeping, waking up, headaches, neck pain, jaw joint pain, chronic pain, I'm going to recommend an occlusal orthotic first before we do anything else. And once you wear the occlusal orthotic, what we're trying to do is figure out, can we relieve the symptoms first and foremost? How do we get your bite back and balanced? And then how do we make a definitive diagnosis once that's all done so we can restore your teeth in a lasting manner? And so if a patient comes into me in state, we'll be going through a series of adjustments between 4 to 6 weeks, sometimes longer if it's chronic, true joint pain. If it's typically muscle in origin, which is the vast majority of our patients, it might be 4 to 6 weeks. And we make these adjustments on the appliance, the occlusal orthotic, every week. Like if you went in and saw a chiropractor, that's the easiest way to kind of describe this. You see a chiropractor, you make adjustments, but these adjustments are working towards an end goal, which is joint stability, jaw joint stability. We have ways to actually verify the jaw joints are stable. And once we do that, then we can make a definitive diagnosis to figure out where the teeth are. So you heard some things that are different between Nightguards and occlusal orthotics. And as I shoot videos in the future, I'll probably really lay those out in a way that makes sense. But Nightguards typically worn at night. They're adjusted one time. They're usually thicker. They're bulkier. They're not as custom fit for you. And they're really not addressing TMJ. It's one of my biggest pet peeves. Most Nightguards do not address TMJ or TMD or occlusal wear in any capacity. They're simply a piece of acrylic and or plastic that's put between your teeth to limit the effects of the tooth wear that happen at night when you are wearing the night guard. An occlusal orthotic, as a flip to that, is something you wear full time. It's adjusted at least on a weekly basis, sometimes on a daily basis, especially if patients are coming to me from out of state. We are custom adjusting this appliance so that the orthotic is designed to help get the bite stabilized and the jaw joint stabilized. And it's a diagnostic aid because once that's done, we figure out where your teeth are supposed to go now that the muscles and joints are in harmony. So it's a very active appliance. Those are the main differences between a night guard and an occlusal orthotic. Because we do get patients that come in all the time. They're asking, well, I've already had night guards in the past. They don't work. And it looks the same as what you're delivering. They're totally different. The only thing that's similar about them is that sometimes they look similar because a night guard made by a dentist might be a piece of acrylic that goes over the top part of your teeth. And the occlusal orthotic that we use is a piece of acrylic that goes over the top of the teeth. But how they function, how we adjust them, how often you wear it, the types of adjustments we make. I never want to sound like I'm full of myself, but one of the things that I learned when I was going through training 7 years ago in this capacity, when I was first learning how to really take care of my TMJ patients, was the types of adjustments we even make on the orthotic is very, very important. You need to have the contacts in the right position. You need to eliminate areas of the teeth that are hitting that do not need to be hitting. And that allows your muscles and your joints to balance themselves. And so that adjustment process is very fine-tuned. We're talking about thickness of a human hair. That's what we're making adjustments on to make sure that the orthotic is working the way it's supposed to be working. And oftentimes what we see is after we make those adjustments, neck pain goes away, migraines start to disappear, facial pain, jaw joint pain, tooth sensitivity, all of these things start to dissipate because the system is becoming more in balance again. And then we can make a definitive, diagnosis of what's actually happening in the system so that we can help things get back to where they need to be. Okay. So you'll notice that process between night guard and occlusal orthotic, totally different, night and day difference. Okay. So that's one of the biggest questions that we see. And I wanted to address that. The other thing I wanted to do on this video today is really talk about another question that gets asked, but it doesn't get asked specifically, is what is a night guard, right? Excuse me for a sec. That's what happens when I go live. I see a lot of times patients, for example, will get Invisalign. They get retainers and they say that is a night guard. That is not a night guard. Those are retainers for your teeth. Night guards typically are thicker, they're flat, and they're designed to have you wear through them. Retainers for teeth, clear retainers, clear aligners, Invisalign, Smile Direct Club. There's some Invisalign company, or not Invisalign companies. There's some retainer companies now where you basically get a night guard that's sent to you. Most of the time, what I've seen, these are not night guards in any capacity, and they are definitely not occlusal orthotics, and they are not going to treat your TMJ or TMD. Please be very careful when you're getting something that's delivered directly to you to solve that problem without seeing a professional. Also, be very careful about things you buy over the counter. There are so many different appliances. If you go into CVS or Rite Aid or Walmart and you look in the dental supply section And, next to the floss and toothbrushes, there's probably like 5 or 10 different variations of nighttime appliances you can wear. There are things that are supposed to treat snoring and tooth wear and joint pain. And a lot of these things that I see can actually cause more harm than good. And, luckily, I've never seen it in person, but I've seen other professionals that I've worked with. If you have something that only hits certain teeth, but not other teeth, all of a sudden the teeth that are no longer contacting erupt. And then all of a sudden you have an open bite. These are not good things. That's very difficult to correct once you have an open bite because of a nighttime, something you put in at nighttime that you got over the counter without consulting with a dentist. I know it, you will save money by doing that. I'm not saying you won't, but the problem is that comes at a cost. There's a hidden cost when you try to save money, especially when it comes to dentistry or a lot of medical procedures by and large, right? So you want to make sure that you are really being careful when it comes to what you're actually wearing at night, what type of night guard. These are very important things. A lot of the patients we see when they're going through occlusal orthotic therapy, it's different than a night guard. It's more expensive than a night guard because we're actively adjusting this, and I'm using my care, skill, and judgment to try to get this patient to an end result, which is pain-free, beautiful teeth, healthy smile, functional smile, where they can chew it and their teeth last a lifetime. So, obviously that's a different dynamic than even something that you just wear at night. And to me, a night guard is like a crash helmet you put on your teeth. If you're going to do nothing else and you want to put something in between your teeth, that's acrylic, and wear out the acrylic and not your natural teeth, that is better than nothing. But even so, getting night guards that are made independent of the dentist can also be very detrimental. I know in future live Q&As, what we will end up doing is I am going to address a lot of common questions that you guys have for me, whether they're in this YouTube page and or Facebook and Instagram and personal. I get a lot of questions from people that are out of state that know that I'm a dentist that specialize in this. Well, you can't specialize in TMJ, but who really focuses on TMJ and TMD. I get a lot of questions about what they should be looking for, what they should be doing, and I'm going to be able to address those questions here. So if you guys have any questions, I encourage you to leave a comment in these videos. If you've liked this video and you found it educational, I encourage you to subscribe, like the video so more people can get these videos and you can get more of them. If you subscribe, then every time that I go live and or post a video about TMJ or wellness-based dentistry, you will be the first to be here. And the other thing we're going to do just on the page, because you've been watching for 13 minutes, fantastic, thank you. Another thing we're going to do on this page is really start to dig into what it is we actually do in our office and kind of give you a sneak peek into our office and how we take care of some of these patients. And we have different modes of treatment for the different offices that I am in. I have one office that's solely dedicated to doing TMJ work, and then I have another office that is spent more time on the oral systemic link and overall wellness and well-being. So with that being said, guys, thanks so much for tuning in today on this live. Hopefully you got value out of it, and I'll see you at the next one. Peace.